Do you know the clotting time for a normal healthy person is around 2 to 8 minutes? So, hello and welcome to this lecture. Today we are going to discuss drug use in disorders of coagulation. This is a series of topics where we discuss about the drugs that are used in different disorders of coagulation. And today the topic is the introductory topic about the blood clotting factors. We already discussed this in physiology and in your other previous subjects. So I'm not going to explain in detail. Rather than I have prepared a lineup of some videos that able to help you to revise this topic, where we can discuss about different clotting factors. We will discuss about coagulation cascade, and I have been sharing one mnemonics to memorize them. So this video is a combination of different videos from different sources that I have collected to revise the blood clotting factors. In the first slide, if you take a look, that there are different clotting factors like factor 7, factor 9, factor 10, and they are responsible for the formation of prothrombin, and that prothrombin with the help of factor 5 is responsible for the formation of thrombin, and then the fibrinogen and fibrin clot will be formed. And if you see the function of heparin, we will discuss in our next lecture. They are blocking this coagulation cascade, and then we will discuss in drugs one by one. So please take a look of these videos that will help you to revise the previous knowledge that you have taken from your other textbook.
Today I have a mnemonic for one of the most important topics, clotting factors. You have to remember one simple sentence. That's it. Where is the sentence? Foolish people try climbing long slopes after Christmas. Some people have fallen. That's it. Now factor 1, F will remind you fibrinogen. Factor 2, P for prothrombin. Factor 3, T for thromboplastin. Factor 4, C for calcium. Factor 5, L for labile factor, which is also called proaccelerin. And factor 6 is actually it's no longer used nowadays, and so you can just ignore it. And factor 7 is for stable factor. Factor 8, A for anti-hemophilic factor A. And factor 9 is Christmas factor, which is also called anti-hemophilic factor B. And factor 10 is for Stewart-Proer factor. Factor 11 is P for plasma thromboplastin antecedent, which is also called anti-hemophilic factor C. Factor 12 is H for Hegman factor, and factor 13 A for fibrin stabilizing factor.
Let's first have an overview regarding what happens in the coagulation cascade. So we have an intrinsic pathway and then we have an extrinsic pathway. They both eventually lead to the formation of prothrombin activator, which is actually the activated factor 10. Once prothrombin activator is activated, it in the presence of calcium ions, it converts prothrombin into thrombin. And when sufficient quantity of thrombin is formed in the blood, it leads to the conversion of fibrinogen into fibrin. But initially these fibrin are just monomers and they cannot form a stable clot. So in the presence of calcium ions, the fibrin stabilizing factor, which is actually the factor number 13, it acts on them and converts them into fibrin polymers by formation of covalent bonds in the fibrin monomers. And eventually they lead to the formation of a clot by attracting lots of platelets, lots of phospholipids and other materials which adheres on them and forms a stable clot which plugs the bleeding site and leads to hemostasis. Let's first talk about the extrinsic pathway. So the extrinsic pathway begins with any factor which causes tissue trauma. Now this trauma can be a trauma to the vascular wall itself, or it can also be a trauma to the extravascular tissue. And this causes the release of the tissue factor, also known as tissue thromboplastin. Now this tissue factor causes the conversion of factor number 7 to activated factor number 7. And then the tissue factor combines with the activated factor 7 in the presence of calcium ions and causes the conversion of factor number 10 to activated factor number 10. And then the factor number 10, which is activated in the presence of calcium ions, and factor number 5 forms the prothrombin activator. And rest events are the same, that is the prothrombin activator, causes the conversion of prothrombin into thrombin. Now let's talk about the intrinsic pathway. Intrinsic pathway begins with any factor which causes trauma to the blood cells directly or causes the exposure of the blood cells to collagen. This causes activation of factor number 12. So when the factor number 12 is activated, it acts upon the factor number 11 and causes its activation, that is 11A. And this 11A factor acts upon the factor number 9 and forms the factor number 9A. And these reactions require some cofactors such as the high molecular weight kininogens and the calcium ions. And then the factor number 9, which is activated in the presence of factor number 8A, which is derived from factor number 8. It combines with the calcium ions and causes the activation of factor number 10. And then the events are almost same as that of the extrinsic pathway, that is combination of the activated factor 10 to calcium ions and factor 5 and formation of a prothrombin activator. And the prothrombin activator subsequently acting on the prothrombin and formation of thrombin. So to summarize what happens in the coagulation cascade, we have the intrinsic pathway and the extrinsic pathway. They both ultimately lead to the formation of a prothrombin activator, that is activator factor 10. And this causes the formation of thrombin from prothrombin. And the thrombin acts on fibrinogen to form fibrin monomers. But these monomers are not stable and they cannot form a clot. So the fibrin stabilizing factor, which is the factor number 13, it acts upon the fibrin monomers and forms a lot of covalent bonds between the fibrin monomers. And this leads to the formation of a fibrin mesh. And this mesh attracts platelets, phospholipids, and forms a stable blood clot, which causes hemostasis. So this was pretty much all about the coagulation cascade.
Even under physiological conditions, a small tear can appear in the wall of a blood vessel. In order to prevent blood loss, platelets and coagulation factors such as the pivotal factor 10, acting in a coordinated manner, close this wound. The platelets are responsible for a first sealing of the tear. Then, a number of coagulation factors are activated, leading to the formation of fibrin strands which stabilize the growing clot. These processes can also be triggered inappropriately and play a major role in the pathology of ACS, VTE, and AF. Thromboembolic disorders can affect both types of blood vessels. Arterial or white clots are primarily triggered by the rupture of an atherosclerotic plaque. Arterial clots are platelet-rich. Venous or red clots, on the other hand, mainly consist of red blood cells and fibrin. Vascular injury, hypercoagulability of the blood, and venous stasis play a crucial role in their development. It is important to note that the formation of both types of clots, arterial and venous, always involves platelets as well as coagulation factors.
Let's take a look of how coagulation occurs in this video. And in this video you can see hemostasis, coagulation and fibrinolysis in an animated way. I have find this video and I want to express this thing. The main components consist of red blood cells, white blood cells, platelets, macrophages, eosinophils, plasmin, fibrinogens, intrinsic factors and extrinsic factors. So when we see the normal blood flow, the red cells, white blood cells and platelets are moving, they are flowing in a direction, And we also have the blood plasma. We also have consist of proteins, salts, iron, fats. The main factor of the blood coagulation is fibrinogen, and you can see the long coil form of structure is present, expressed as fibrinogens. We also have extrinsic factors that are expressed in the red color, and we also have intrinsic factors. So we have both extrinsic factors and intrinsic factors, and then obviously there are common pathways that overlap extrinsic factors and intrinsic factors that exist at same time. We also have plasmin, and we already studied these all things in our previous lectures. So let's see that what happened that when a person have injured his feet, fingers, so what will happen, there will be a rupture. The vascular injury can be expressed at, you can express as vascular injury, and then obviously the blood will flow out, and to stop the blood flow there will be the platelets and collagen adhesion. Platelets are plays an important role to stop the bleeding and to adhere at the site of injury, so that platelets will adhere, aggregate, and stop the blood flow. So along with the platelets, we also have the fibrinogen that helps in the process known as hemostasis. So platelets and fibrinogens will be attached to the surface where the bleeding occur, and then it also activated other factors, extrinsic and intrinsic factors, that are responsible for helping the blood coagulation. And the factors of blood coagulation transform fibrinogen into the polymers of fibrin. And after a few hours, 24 to 48 hours, the process of coagulation where the molecules of plasmins are attracted to the fibrin, and then the fibrinolytic degradation product are phagocytosed by macrophages and eosinophils. And the normal blood flow is then restored. So thank you so much.